This regular meeting of the Board of Health of Franklin Township is called to order. Madam Master Clerk.
In accordance with the Open Public Meeting Act of the State of New Jersey, adequate notice of this regular meeting of the Board of Health was made by the posting on the front doors of the municipal building, posted on the Township's website, and electronically transmitted to the officially designated newspapers, indicating that this regular meeting would take place via WebEx at 6 p.m. on Tuesday, June 22nd, 2021.
Thank you. If we could have the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam Clerk, call the roll, please.
Councilman Embarrasson?
Here.
Councilman Chase?
Here.
Councilwoman Francois?
Here.
Mayor Kramer?
Here.
Councilman Onijaka? Councilwoman Pruitt?
Here.
Councilwoman Udine?
Here.
Deputy Mayor Vassanella?
Here.
Councilman Wright?
Item number 4, approval of the minutes. I present the Board of Health June 23rd, 2020 minutes to the Board of Health for approval. Do I have a motion on the minutes?
So moved.
Second.
Moved and seconded. All in favor of approving the minutes, say, I'm sorry, is there any discussion, any corrections? Hearing none. All in favor of, I'm sorry, we have to do this by roll call, Madam Clerk.
Yes. Councilman Embarrasson?
Yes.
Councilman Chase? Councilwoman Francois?
Abstain.
Mayor Kramer?
Yes.
Councilman Onijaka? Councilwoman Pruitt?
Yeah.
Councilwoman Udine?
Yes.
Deputy Mayor Vassanella?
Yes.
Councilman Wright?
Mr. McQueen, I just got a text message from Bill Bowman saying he can't get into the WebEx, though I see that others are. I don't know if there's.
We have people in the WebEx.
Okay. All right, I am going to abuse my prerogative as chair to do something off the agenda. And that is, I would like to give a commendation to Dr. Namitha Reddy. This is a surprise to her. It was not on the agenda. Whereas the outbreak of COVID-19 has spread worldwide, leading to an ongoing pandemic. And whereas Namitha Reddy, MD, NPH, Director and Health Officer of the Somerset County Department of Health, has worked diligently against COVID-19. And whereas Dr. Reddy executed an enormous COVID testing outreach program and collaborated with private labs to perform over 11,000 tests on Somerset County citizens. And whereas Dr. Reddy coordinated a robust outreach effort that included the operation of 2 of the most successful drive-through clinics in the state at Raritan Valley Community College and Rutgers Plaza. Now, therefore, I, Philip Kramer, Chairman, on behalf of the Board of Health of the Township of Franklin, Somerset County, New Jersey, commend and express its gratitude to Dr. Namitha Reddy for working tirelessly during this pandemic. Congratulations, Doctor. You deserve it. I had innumerable contacts with you during the pandemic, and you were always very helpful, very knowledgeable, and I know you worked many, many long hours. Not what you signed up for.
No, but thank you, Mayor, and thank you to the board. It's much appreciated to be recognized for something that we didn't sign up to do, but it's what we look forward to. That's what our training is about. That's what we plan to, and then that's what we exercise at the health department. And I'm glad we were able to execute it as effectively as we did. Appreciate the confidence, and thank you for the commendation.
You are welcome. And now on to item number 5, Advisory Board of Health report. You're up. While she's doing that, Mr. Bowman, Mr. Bowman writes that when he tries to sign on, this is the message he gets. Your email address does not match any of the panelists' emails address. So maybe he's trying to sign on as a panelist. He has dialed in them.
Yeah, that's what it sounds like. I'll try to check the link on the website.
Okay, thank you. Dr. Reddy, whenever you are ready.
Okay. I just want to make sure that we can actually see the PowerPoint.
Yes, it's quite visible.
Okay. So just wanted to, while, as the mayor mentioned it at the beginning, we've been through a pandemic for over 16 months at this point. And while everyone thought, that was the only thing that we did, while it was the primary work that we did, and it took up most of our time, we did continue with everything else that the health department is tasked to do. And then we did that with no gaps. So I'm proud of the team, and I'm proud of everyone in the health department for not only responding to a once-in-a-lifetime event of a pandemic, but also continuing to do what we were tasked to do as the health department. So this is an overview of what the health department does. Consumer health, which many people know as the inspectors, the restaurant inspectors, and then the sanitary inspectors. We do health education and health promotion. We do chronic disease and cancer prevention and in the community. We also do environmental compliance and enforcement. This is our CHA program, that is air and environmental, that is assessing the air quality and water standards within the community. Communicable disease prevention and control, which mainly the last year was COVID related, but we also assessed and responded to any other reportable communicable disease that is mandated by the state of New Jersey. Our emergency public health preparedness and response, which came in handy, the number of hours of training and then the prep that we put in over the years came to fruition during our response to this pandemic. And our childhood-led poisoning prevention programs. So these are all the programs that we as the health department do, and which we continue to do during last year despite the pandemic. So starting with our consumer and environmental health programs. So as I mentioned, the REHS staff.
Dr. Reddy, I'm sorry to interrupt you.
Sure.
I'm getting word that people can't get in, possibly because we misadvertised on the webpage.
Yep, I am looking at it right now. Lou Rayon should be able to get in.
Right, but if I may finish, Mr. Ranon, I saw that you were on. Are you still on?
I'm in.
So if the public get in, do we need to pause until they can get in?
So, Mr. Mayor, if you're having any discussions, I just logged in through the Township Council link, not the health department. There's a Board of Health calendar event and there's a Township Council calendar event. I was able to log in from a separate device through the Township Council and see the screen. So if anyone needs to log in, they can log in through the Township Council website calendar link but I didn't try the Board of Health link, but I did get in through the council link.
All right, so I'm sorry, Dr. Reddy, I apologize. I'm gonna pause for a minute to allow people to get in that way in case they're trying to get in that way. I don't want to, unless you can correct me, Mr. Attorney, I don't want to be accused of not having this open publicly.
Yes, sir.
Well, I see the Franklin Reporter has gotten on. So I'll give it another few seconds, another 15 seconds, and you can start again. Again, I apologize, Dr. Reddy.
No, not a problem, not a problem, Mayor.
Okay, go ahead.
Right, so we are talking about our consumer and environmental health program, which our REHS staff, who is our registered environmental health specialists, who go out into the community to assess and make sure that the restaurants and in the pools are functioning appropriately. So as I mentioned, despite the pandemic, while they supported and helped in all case investigations, contact tracing, which was more of a health department initiative on the whole, they still took the time to ensure that they went ahead and performed their regular duties as was assigned to us in the health department. Here listed are the numbers of inspections that were conducted during 2020. Inspections, we did 545 retail food establishment inspections and 94 re-inspections. We did retail food pre-ops, 19 inspections and 7 re-inspections. We did 36 temporary food inspections, 3 mobile food truck inspections, inspected 20 child health care facilities, 29 inspections for recreational bathing, and then 9 re-inspections, and 1,228 inspections for housing reoccupancy. We also responded to complaints from the public, and 91 retail food complaints were investigated. Garbage and debris complaints, 272 were investigated. Insect and vermin, 36 investigations. Property maintenance, 407 investigations. And housing and multiple dwelling complaints, we investigated 79 of those. Coming to our disease prevention, as you can see, this is a list of all the towns that we provide communicable disease investigation and response. We responded to close to 6,000 communicable disease investigations in Franklin Township. Most of them were COVID, considering we were in the middle of a pandemic, but we continued to do other case investigations as well, depending on what reports we got from the labs. Next is our CEHA program. The CEHA program provides environmental compliance and enforcement measures through the DEP, and the goal is to increase overall compliance among regulated entities for provision of clean air, water, and soil throughout our county. So we provide, through the CEHA program, we provide oversight of solid waste transportation and disposal, safe drinking water, which is PNC wells, air pollution and emission permits. We assess water pollution, pesticide application, motor vehicle idling, and we support hazmat emergency response and household hazardous waste drop-off events. We also investigate complaints from citizens regarding environmental issues, and we respond to nuisance, noise, odor, and visible emission complaints. So Herein lists the number of complaints our CHA program received and responded to. There were a total of 103 inspections and investigations performed in the township for the year 2020. Solid waste related were 14. Safe drinking water related investigations or complaints were 5. Air emission permits related complaints investigated were 21. Pesticide related inspections and investigations were 5. Complaints or referrals from the New Jersey Department of Environmental Protection, we responded to 27 of those investigations, and open public records requests, 30 of those. These were all for the Township of Franklin for the year 2020. This is a map of where in Franklin Township most of these investigations were. The legend is here based on the color, but this map provides a good view of where the complaints were that were investigated in Franklin Township. Our next program is a childhood-led prevention program, and in Franklin Township, 1,836 for the year 2020. These are the various measures that we looked at, and we had 0 less than 3 micrograms per deciliter. The only complaint from 5 to 9.9 micrograms, well, one of those was investigated in, 3.0 to 4.9 was one. We had 5 to 9.91, and we had 15 to 20 micrograms per deciliter one, so a total of 3, and then 3, 20 to 45, so a total of 8 investigations for elevated blood levels in children were investigated in Franklin Township.
Did we find a source on those?
I'm sorry, Mayor Kramer?
Did we find a source?
We usually, once we get an elevated blood level complaint from a child, we usually do an inspection of the indoor environment and an external environmental investigation. And depending on what we find there, our next recommendation would be to abate, depending on the number of accessible areas for the child that may have contributed to it. So that really is the process.
Okay.
Again, the goal is to reduce the burden of lead poisoning for all children. And as we move forward through this grant year, our objectives are to increase the number by 10% of the number of children of age that have been screened for elevated blood levels. So that is our goal as we move forward. Last year, due to the pandemic, a lot of these activities were suspended because there was no face-to-face interaction. But we are going to move ahead with this goal to try and increase the number of screenings that we provide for children in our communities. So again, our future goals as we move forward is to provide outreach to healthcare providers and daycare centers so they are aware of what they need to do when they have children come in. We're also going to assess and then provide an educational campaign so public is aware of what to look out for in terms of lead and the things that could contain lead, some unknown substances, regular daily use stuff that people could that could contain lead. So it's more of an educational campaign that we plan to do so public is aware of what to look out for and avoid lead poisoning in children. Our next program is the Regional Chronic Disease and Cancer Coalition. The goal of this program is to decrease the burden of cancer across the continuum of care. Our objectives are decreasing HPV-associated cancers, providing education to women about breast cancer, encouraging regular screening, implementing tobacco point-of-sale policy, enhancing the quality of life for cancer patients and survivors with cancer. We are also moving to connect residents to cancer resources and prevention and education of other cancers like ovarian, prostate, colorectal, and then skin cancer. So this is the highlights for our program last year. Our community health workers put together a newsletter in collaboration with Burlington Camden RCDC, and then this gets distributed quarterly to everyone. We also started an HPV social media campaign to dispel myths surrounding human papillomavirus and the vaccine. We send out monthly health watch flyers on relevant health observances geared towards our African American population. We also have many initiatives in partnership with wellness coalitions to target screening and associated observances which are geared towards populations impacted by this. We also presented about our coalition at the New Jersey HC Diabetes and Hypertension Symposium. This is being recognized by the CDC and is going to be featured on the CDC's website. We ran our program virtually, the Cancer Thriving and Surviving program. We ran it virtually this past October and November, and we're also planning to do that virtually again this October and November with the Somerset County Office on Aging. So another program that we're planning through our Chronic Disease Coalition is a virtual event in the fall. It's called What's Up With My Gut, which is going to touch on gastrointestinal conditions, and it's linked to colorectal and ovarian cancer. So it's a lot of chronic disease education on cancer and providing resources and ensuring that people have the ability and the resources to go in and get screened for and get help with cancer. Our next program is our public health preparedness program. The goals of this program was to enhance and update the public health emergency plans. In 2020, most of our time through this program was associated with response to the COVID pandemic. In 2020, a total of 453 links messages were sent in the following alert categories. The public health information, 338 messages, public health updates, 74 of them, public health advisories, 32, public health alerts, 9. We also put together information that we shared on our webpage, and we also coordinated most of the clinics and both vaccine and vaccination and testing clinics in the county. So all our plans over the years were used in trying to make sure that our response to this pandemic was as good as it was. As we move forward, the goal for health education and promotion, which was a piece of our program that were utilized in many different program areas, from lead to community health, to trying to get people to understand the response to this pandemic. All of that came together with the health education and promotion program. Our goal as we move forward, as always, is to move towards a healthier community. And our program provides teaching and then print offerings, and the goal being to improve the health and of people and businesses in Somerset. In 2020, our social media campaigns moved towards health observances and then all related public health topics. We managed the content on our website, which included data associated with the COVID pandemic. Information was sent out through our newsletters, which were sent out every Friday, which included the latest information on the COVID pandemic as it evolved, and it also included the numbers and then data associated with the trends associated with the COVID pandemic. We continued food handler trainings. We also end of 2020 did flu prevention as a part of our training and associated with COVID. Many public health press releases were done over the course of 2020, and specifically related to COVID-19, the educational flyers, the outdoor dining checklist, the press releases, our weekly situation update, handouts at most of the testing clinics and vaccination clinics. We provided outreach to the school nurses and daily phone and website updates for COVID case numbers and deaths were also coordinated through our health education program. So that in a nutshell is where our activities were in 2020.
Okay. Council members, do you have questions? So, can you give us a brief synopsis of where we are COVID-wise?
So the trends have been really good, and in terms of where we were for the first time since the beginning of the pandemic, over a week ago, we had 0 cases in Somerset County. So that is a great place to be. But over the past 3 weeks, our trends have remained within single digits most of the time, and in our new case numbers have been within 10 to 12 cases per day. So this is in contrast to the time last April where we were 300, 400 cases. So all our trends in terms of percent positivity, in terms of the transmission rates, and in terms of new cases that we're seeing in Somerset County, all of them have been on the downward trend, and mortality has reduced as well. So our trends are good. We're continuing with our vaccination efforts. We're moving our vaccination from RVCC to one site in Bridgewater, where we will be providing all 3 vaccines. We will continue to provide vaccines within communities that we think we need to increase our vaccination rates. So we will be doing pop-up clinics. We continued to provide vaccination within school settings in relation to Pfizer allowing 12 and over to be vaccinated. So we're continuing with that effort. We're also continuing to seek out businesses that may want to get their employees vaccinated. So all of our vaccination efforts are continuing. In addition, we're also continuing with testing for anyone that requires testing. And as we move forward, when the schools reopen in the summer, the schools were provided an Abbott testing kit, and we will be closely monitoring to make sure that we are not missing any cases that may occur within the school setting, so we can identify and contact trace and ensure that we contain, if at all, we start seeing cases. So we have all the systems in place at this point, and hopefully these positive trends will continue as we move forward. But I would really like to thank the people that have stepped up to ensure that they get vaccinated. So they're doing their part to prevent the spread of this virus.
I know the Delta variant, which was first discovered in India, has been on a bit of an increase statewide. Do you have any information about what it's doing countywide?
So it is our highest variant, and at this point we are monitoring the number of variants within our county, and our UK variant is still the highest circulating variant. Second now, as you mentioned, Mayor Kramer, the Delta variant is seeing an uptick as well. But at this point, there is not enough information to correlate how that is impacting the people that have been vaccinated. Suffice to say that we are not seeing an increase in cases because of the increase in circulating variants. But is that because of vaccination, or is that because of something else? And I think we require a little bit more in-depth analysis to be able to make that correlation. But suffice to say, we have circulating variants, not just the UK variant and then the India variant. We have the Brazil variant. We have all variants that are circulating, but so far it has not translated to increase in the number of cases.
Great. Any questions from council?
I do, Mayor.
Go ahead.
Thank you.
Okay.
And thank you, Dr. Reddy, for this really great presentation. Why don't we take
down the presentation? So Go ahead,
Um,
Councilwoman, sorry.
No worries. So as we, we are not out of the woods yet, obviously, with the pandemic, and it's still quite a focus. But as things are looking better, numbers look promising. I guess, are there any specific program priorities that the health department wants to undertake specifically in Franklin, kind of recognizing everything we learned about kind of access to health and all the barriers that kind of made themselves more visible when we look at, disparities across races and income levels. Has there been any thought given to kind of tweaking or coming up with specific programs or thoughts about programs that will kind of target these disparities that became very, very obvious in 2020?
Thank you, Councilwoman Pruitt. Yes, and that is one of my main goals as we are winding down our active response. We have our social services coordinator here that is actively working on trying to identify gaps within communities. So once we identify the gaps, and then you alluded to most of them that we know are a problem, communities that are struggling with vaccine hesitancy, what the reasons were for vaccine hesitancy, whether it was access to vaccines, whether it was misinformation. Those are the things that we want to assess and want to target the gaps that we've identified within these communities and then go in and try to address those gaps. So yes, in general, all the highlights that you pointed out are the reasons that contributed, we know in general. But as we move through this, we'd like to drill down a little bit more specifically on areas that we understand had vaccine hesitancy, but what was the reason? So those are the things that we're trying to move forward as we try and address these gaps within communities that we know had an issue.
Thank you, Dr. Reddy. I guess I have one follow-up question. So I guess pandemic aside, looking at broader health inequities, and it could be some of the programs that you already went through, but is there anything that perhaps needs to be reprioritized or refocused on? COVID, aside, but any kind of general health.
So I think one of my focus has been to try to address the child clinic within Somerset, within Franklin Township, and we worked with Zufall to try and see if we could address them more within the school setting or to have more of a larger presence so there is continuity of care. So, we have those programs that are dedicated towards the adult and maternal child health, and then we have some programs that are dedicated towards child health. But I think my focus would be to try and make that a continuum. So, we are not just focusing on the child and then did they receive the vaccine, or we're not just looking at the parents and saying, oh, you're ill now, let me take care of you, but almost look at it as a unit. So there is some continuity of care as we move forward through the family unit. So I think as we move forward, that should be our focus, to try and combine these programs so it's not so siloed, if you will. So we're dealing with this as a family unit because in my opinion, I think a lot of those factors are interrelated. So just focusing on a child not getting a vaccine or focusing on a parent that's utilizing emergency room as a way for primary care, I think needs to be addressed in a larger setting as a group. So that I think is something that we need to move forward and try to assess.
Thank you, Dr. Reddy. I have no more questions.
Thank you.
Any other council member have a question? Okay, hearing none. Does the Advisory Board of Health have a report? Okay, not hearing one. Is there any other business before the Board of? Oh, Linda, yes.
I can't start my video. I am a member of the Advisory Board of Health, but I don't have a report on the whole board. But I just wanted to report, which to me is a public health issue, about the issue of Nessie getting, is that an appropriate thing to bring up now?
Sure.
You know, it just very briefly, probably a lot of council members already know, but even though they, Williams Transco was denied the permits, the water quality permits by both New York and New Jersey for, I don't remember what, I think the third time or more on May 20th, 2020. And just recently, right before their certificate of need from the Federal Energy Regulatory Commission was going to run out, they appealed to them saying that the reason they did not have time to complete the project, which they were not allowed to start because they didn't have the permits, was because of the pandemic. And FERC did allow them that 2-year extension. So we are expecting them to apply again to both New York and New Jersey for permits. And, you know, just what Dr. Reddy was talking about, the impact on air pollution, water pollution, safety, and health, and just also the general contribution to climate change, which of course is all tied up with these types of pandemics. So we are mobilizing people again to be aware of upcoming need to stop this project, you know, sign petitions, write comments. And so we've been meeting, and we will update our website and keep the council updated.
I'm sure you will, because you did such a great job last time. It's a little bit like Chucky, it won't go away.
Yeah, unfortunately.
Okay, so the next item is any other business before the board, to be brought before the board. Hearing none. Do I have a motion to open to public discussion? So Councilwoman Francois moved it and Councilman Vasanella seconded it by also moving it. All in favor of opening, say aye.
Aye.
Aye. Opposed, say nay. Motion is carried. We are now open to the public. Anyone may speak for 3 minutes on a Board of Health issue or a health issue in the town. No yielding of time. State your name and address. Mr. McQueen.
Yes, any member from the public wishing to speak, we ask to use the chat function, raise hand feature, or *3 by telephone. Again, anybody from the public wishing to speak, use chat function *3, or the chat function, raise hand feature, or by telephone *3. Franklin, reporter, you are unmuted.
Thanks very much. I have a couple of questions for Dr. Reddy. Dr. Reddy, you put out in your presentation some numbers, number of cases that were being investigated, number of cases of kids who had elevated lead levels in their blood. Is there any kind of context for these numbers? Is there something on the county website where we could look at and see past years for these kinds of numbers so we can see what the trends have been?
So we do not have it on our website, only because sometimes the numbers are so few and it's easy to identify people within children and in those numbers. But I could certainly look at the trends and then provide a summary if that would be helpful.
Okay, and when can I get that?
We would probably have something to you by early next week.
Okay. I might suggest you put the numbers up there because, I mean, in this one, you only had eight cases of elevated lead levels. There's thousands of kids in this town. There's no way anyone's going to know, you know, who those kids are. So I don't know how much lower the numbers could be that you would have some sort of identification issues, but I just would suggest in the sense of, in the spirit of transparency and openness, that those numbers from past years be put up so folks can see what, if any, the trends are.
We
That's
could
all I have.
certainly
Thank you.
do that. Yeah, so as I said, I will have to take a look at the numbers and see what the best way to provide that information would be so we can ensure confidentiality. And I will take a look at it and provide you with a summary early next week.
Okay, thanks very much. That's all I have. Thanks.
Thank you. There's one other caller.
Caller, do you have any comments to make?
No.
Thank you.
Hi, fellas. How you doing?
Okay, Mr. Mayor, I do not see anybody else indicating they would like to speak.
Do I have a motion to close the public portion? Moved in second. All in favor of closing public portion, say aye.
Aye.
Opposed, say nay. Public portion is closed. Do I have a motion to adjourn the Board of Health meeting?
So moved.
Seconded. Moved in second, and all in favor of adjourning, say aye. Aye.
Aye.
Opposed, say nay. We are adjourned. Be well, Franklin. Mr. McQueen, are we staying on here or are we
That is,
signing?
yes, Mr. Mayor, I will put us back into a practice session so that callers or people dialed in now will not see anything, but we will stay on the same link.
Great, thank you.
You have just heard Dragnet.
Mr. Mayor, we are live.
Files. Technical advice comes from the Office of Chief of Police W.H. Parker, Los
Everybody,
Angeles.
we're getting some background.
Yep.
This work session, regular meeting of the Township Council is called to order. Madam Master Clerk.
In accordance with the Open Public Meeting Act of the State of New Jersey, adequate notice of this work session regular meeting of the Franklin Township Council was made by the posting on the front doors of the municipal building, posted on the township's website, and electronically transmitted to the officially designated newspapers, indicating that this work session regular meeting would take place via WebEx at 7 p.m. on Tuesday, June 22nd, 2021.
Thank you. Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, Councilman Barrison, sorry, if you could lead us in the invocation.
May those assembled here today enjoy the many offerings of our township. May we abide by the rules we have established, those of trust, fellowship, and ethics, and may we place service above self in our daily endeavors. And may we always test ourselves and our efforts to be sure they are truth, good, and all concerned of benefit to mankind and provide peace and understanding. Amen.
Amen. Madam Master Clerk, please call the roll.
Councilman Barrison,
Here.
Councilman Chase,
Here.
Councilwoman Francois,
Here.
Mayor Kramer,
Here.
Councilman Onijaka,
Here.
Councilwoman Pruitt,
Here.
Councilwoman Udine,
Here.
Deputy Mayor Vasanella,
Here.
Councilman Wright.
Here.
Mr. Mayor, if we could just remind everybody to please stay muted. We are getting a lot of background noise.
Thank you. Commendations and proclamations, the Juneteenth proclamation, Councilwoman Pruitt.
Thank you, Mayor. So Juneteenth proclamation. Whereas Juneteenth is the nation's oldest celebration commemorating the day which marked the effective end of slavery. And whereas on June 19th, 1865, Union General Gordon Granger led thousands of federal troops to Galveston, Texas, to announce that the Civil War had ended and slaves had been freed. And whereas today we commemorate the anniversary of that delayed but welcome news, and whereas decades of collective action would follow as equality and justice for African Americans advance slowly, frustratingly, gradually on our nation's journey toward a more perfect union, and whereas Juneteenth is a time to recommit ourselves to the work that remains undone, and we remember that even in the darkest hours, there is cause to hope for tomorrow's light. And now, therefore, I, Crystal Pruitt, Councilwoman at Large, and Philip Craner, Mayor of the Township of Franklin, County of Somerset, State of New Jersey, on behalf of the Township Council and the citizens of the Township of Franklin, proclaim on this Juneteenth that today, no matter our race, religion, gender, or sexual orientation, we recommit ourselves to working to free modern-day slaves from around the world and to honoring in our own time the efforts of those who fought so hard to steer our country truer to our highest ideals.
Thank you. The next item is public discussion. Do we have a motion to open to the public?
So moved.
I think. We have a second.
Second.
Moved and seconded. All in favor of opening for public discussion, say aye.
Aye.
Opposed, say nay. Motion is carried. We're now open to the public. Anyone wishing to speak? We are limited to 3 minutes on subject, anything to do with government. No yielding of time. May only come up once. Please state your name and address. Mr. McQueen.
Thank you, Mr. Mayor. Anybody from the public wishing to speak, use the chat function, raise hand feature, or *3 from your telephone. Again, anybody from the public wishing to speak, please use the chat feature, raise hand feature, or *3 from your telephone. Mr. Guy, you are unmuted.
Okay. You can hear me? Sorry about that. Benjamin Guy, 35 Patton Drive, Somerset, New Jersey. I wanted to ask the town council just because it came up over the weekend for the Juneteenth holiday, and I think there was a rally down in Trenton for it. I was asking the town council from a general census, because I didn't really hear it discussed too much here, is where we stand with community civilian review boards. That is one thing, and then where do we stand with ARC 145, which has to do with minute the 13th, to actually make sure that we have the legal right to be free in the actual country itself, because that bill was never really amended, and we wanted to know exactly where most of the town council actually sits with that. Angela McKnight actually sponsored this bill. I think Joe Danielson actually is a part of the subcommittees here, and I wanted to see where the town council people actually stood with some of these issues that were going on with the state of New Jersey itself. So we didn't really hear no statements or votes. I think this was brought up last year during the COVID cycle, so we're bringing it up again because it's before the assembly bills, and we just want to know where the town council actually stands with some of these sort of statewide issues. We heard about medical marijuana, but we didn't hear about other specific issues that are actually affecting the communities at large also. And then additionally, for with the Parks and Rec Department, I know we're having problems with the Colonial Park with the county parks for the water. I think the waterworks that's over in the county park itself, and I heard the actual county freeholder and give the freeholders meeting, they gave an update on the report, but I want to make sure that we were doing that for the public here, just about our parks and what's open and what's not going to be open for the summer and what delays are going on. So those are my basic questions at this specific time frame.
Anyone else wishing to speak?
Mr. Mayor, we have a caller with 908-305. You are unmuted.
Oh, thank you. This is Jim Johnston at 34 Norwich Place in Somerset. I'd like to talk about the legalization of marijuana. I think that's a good thing, or the decriminalization, because I think the way the laws used to be, I agree that they were way too harsh. So I think it's a good thing that it's been legalized. And also, I am not against marijuana for medicinal purposes, but I do not think that we should go to the opposite extreme, whereby we encourage people, or not encourage people, but we make available to people in our local neighborhoods places where they can buy marijuana for recreational purposes, and especially near schools. And there's been a growing bipartisan opposition to this. The towns of Manville and Bridgewater, which are Republican town councils, they have banned marijuana sales in their towns. And Piscataway and South Brunswick, which have Democrat town councils, they also have banned marijuana sales in their towns. And just today or yesterday, it was announced that East Brunswick has also banned marijuana. So there's a growing list of towns surrounding Franklin that have banned the sales of marijuana, and that means that Franklin is getting to be in the minority almost. And now the mayor of Piscataway, he said that the reason they did that was because they want Piscataway to stay a family town for children to be raised, and an attractive community for mom and pop stores, for large corporations. Also, I think that if the surrounding towns that surround Franklin have banned the sale of marijuana, does that mean that people from those towns will come to Franklin to buy marijuana from here for recreational purposes? So that's a concern I have. So if we could address that, I would appreciate that. And I thank you very much.
Thank you. Anyone else wishing to speak?
Yes, just a reminder, the chat function is not managed. Mr. Grimes, you are unmuted. Caller, if you could lower your hand by hitting *3 again, please.
Good evening, Council. Can you hear me?
Yes.
Okay, my name is Edward Lefty Grimes. I'm with sativacross.org. We're a 501c3 here in New Jersey advocating for disabled rights and for cannabis patients' rights. And I want to thank you for considering the sick and the dying and putting the last first in your town, allowing patients to get their medicine. A lot of towns are banning medicine, and you got disabled war vets in wheelchairs that you're basically making them suffer in certain towns. You know, it's very hard to get anywhere in a wheelchair, and you're making it so much easier for like disabled war vets and kids with cancer and just sick people to get their medicine, because we can't travel. We need help. We're getting hit from all sides with taxes and moldy cannabis from the corporate cannabis, and we really need help. And now with recreational cannabis, there's going to be longer lines. When people in wheelchairs get to the front of that line, they're going to be out of the strains that they need, out of the amounts that they need. So yeah, I appreciate all you're doing for patients, and I appreciate the prayer. I think we need to put the last first, and we need to consider the sick and the dying before anything else, and medical cannabis before anything else. I just want to thank you, and I'll end with this. They went with songs to the battle. They were young, straight of limb, true of eye, steady and aglow. They were staunch to the end against odds uncounted. They fell with their faces to the foe. They shall grow not old, as we that are left grow old. Age shall not weary them, nor the years condemn. At the going down of the sun and in the morning, we will remember them. Thank you, Council.
Thank you. Of course, people can speak about anything to do with government during this session. I will remind you there is another public portion when we discuss the cannabis ordinance that people can speak specifically on that. I'm not trying to prevent you from speaking about it now. Continue, Mr. McQueen.
Yes, anybody else from the public wishing to speak, please use the chat function, raise hand feature, or *3 from your telephone. Mr. Mayor, I do not see anybody else indicating they wish to speak at this time.
No one come forward. I'll motion to close the public portion of the meeting.
Second that.
Moved and seconded. I'm just looking over the list. No one else has suddenly raised their hand. All in favor of closing the public portion, say aye. Aye.
Aye.
Aye.
Opposed, say nay. Motion is carried. Public portion is closed. We are now on to council comments and reports. Councilwoman Pruitt, then Francois, Amberson, Udine, Chase, Wright, and Oni Jaka, then of course the deputy mayor.
You forgot me.
I said right. Councilwoman Pruitt.
Thank you, Mayor. First, I do want to thank the Somerset County Health Department, our health department, and Dr. Reddy for her presentation that she did at 6. Appreciated the visuals and walk through the different programs. Obviously, you know, am encouraged and look forward to seeing what else they do and how else they can partner with some of our community organizations and kind of address health disparities and other health related issues, specifically in older communities and communities of color. I was unfortunately unable to participate in Franklin Township's Juneteenth event hosted by the Somerset County Black Caucus, but I did lurk and saw all the pictures, and it looks like it was a really, really great event. It was also really meaningful to be able to do the Juneteenth proclamation, especially since this year it was signed into law as a federal holiday, similar to what it was in the actual proclamation. Let us not forget that there's still work to be doing, including, you know, addressing health disparities, socioeconomic disparities, energy equity, which, you know, I personally work on with my role at the board, and, you know, voting rights and battling voter suppression. And there's still a lot to work to be done. So while we can celebrate Juneteenth, we should also be using that time to really look forward to see what other work we could be doing in dismantling the structures of power that keep people suppressed. To that end, I guess I'll acknowledge Mr. Guy that, you know, obviously we are not state legislators, so our comments on pending legislation on the state level really has no bearing. But at my time when I was working in the legislature, I was supportive of the legislation you're talking about, making amendments to indicate freedom of African Americans, and just updating some of the charters for the state. And obviously still supportive of it now. But other than that, there weren't any committees that I can report on that I can recall. And that being said, that is my time. Thank you.
Thank you, Councilwoman Pruitt. Excuse me, Councilwoman Kimberly Francois.
Thank you, Mr. Mayor. Yeah, I did have the esteemed honor to attend 2 Juneteenth celebrations this year. I was at the Somerset County Democratic Black Caucus Juneteenth. And also, there seems to be an echo, right?
So if everyone could mute, please.
Yeah, Mr. Mayor, yeah, we're getting feedback from Councilman Onijaka. I'm going to mute him again.
Oh, thank you. Thank you very much for that. And also I attended the Week of the People Juneteenth. But at both events, there was lots of entertainment, very well attended, and you were able to get your vaccine on location, which was great. We also had the youth center booths at both locations, and we gave out information about what's the upcoming youth center. And one thing I wanted to mention is that we do have the youth center manager position that became vacant because of Bruce Bentley's passing away. that has been posted on the Franklin Township main website, on our recreation social media pages, the NJRPA, the NJLM websites as well. And that position will be closing in terms of the posting on July 9th. We also have additional youth center positions that will be posted on beginning on June 28th, and they will remain posted on those websites that I just mentioned. And we have positions open for youth center program coordinator, youth center program assistant, youth center security personnel, as well as a clerical staff. And those positions are all part-time. So while I was at Juneteenth, there were quite a few people that approached me about the youth center. When is it going to open? What's going on? Are there positions available? How can I get involved? And so obviously we do have a youth center website, and we encourage people that want to get involved to become involved. As we get closer to opening up the youth center, we recognize the fact that everybody's excited about it, and we come one, come all. We want everybody involved and everybody to be engaged. Thank you, Mr. Mayor.
Thank you, Councilwoman. Councilman Ron Ambarrison. You're muted, sir. You're still muted.
Sorry about that. Thank you, Mr. Mayor. My comments will be very brief. It is great to go outside finally and meet people in real instead of zooming all the time. For me, it was fantastic. I've been vaccinated, so are many people, I assume. The outdoor events especially was very, very enjoyable. Obviously, I ventured on a few of them in the last week or so without mask, and it was really enjoyable. And I think people are coming out in droves to these events and are just having a good time. I think our township, I was also fortunate to be at the Juneteenth event. Both of them attended by Councilwoman Francois. By the way, I'm also a Black Caucus member at the county level, so I get to attend those events. It was quite revealing to hear people that many of the people even here, some lawmakers inclusive, that had known about Juneteenth very, very late in the game, only a few years back. So it was a very good move by the administration to recognize Juneteenth as a federal holiday. I think that should bring a lot of exposure and awareness to the history of the Black slavery and the emancipation of them. So I think that's a good thing. In addition to that, I think we all, I think, saw some of the celebrations of the 75th anniversary of Frank Resta's shop at the corner of Amel Road and Cedar Grove Lane. Mayor was there with me as well. I'm sure he will provide a quick report. That was a great business, and a lot of people showed up for that as well. So I think the town is coming back alive. I wanted to compliment our rec department for hosting our first outdoor event at the gazebo, the Peas and Carrots music concert. It was reasonable. We had a good turnout, I would say, considering the conditions and the uncertainties and the lack of exposure. I think I put that out on the Facebook. Many comments, good comments, but I think some other people have still not known about our events. So we have to find maybe more creative ways to let people know of the events. I think if they had known about them, they would come out. And I just posted our link on the website about the upcoming events, July 21st and August 18th. But I think let us maybe call the newspapers and maybe a week ahead and let them publish a current event note or something like that. I think the papers are looking for events that they can promote. So that would be a good thing. That's all I have, Mr. Mayor. Thank you.
Thank you, Councilman. Councilwoman Shipa Udine.
Thank you, Mayor. Well, first, I want to wish everyone that celebrated Happy Father's Day. I hope everyone enjoyed it and had a lot of good food and barbecued over the weekend. I couldn't attend. I was unable to attend the Juneteenth this time around, but hoping that I'm able to attend in the future. But I did attend them virtually. I know Ram, you posted some things, and our local news reporter, they posted some things. So I did attend those virtually. So it's very nice to see that folks are starting to now come out and definitely have some face time, which is probably much needed for a lot of us. Other than that, Mayor, I didn't have any community meetings from the last township discussion, so that's all I had for you. Thank you.
Thank you. Councilman Wright. You're muted, Councilman.
I only have a couple things to report, and two of them already were reported from Councilwoman Francois and Councilman Ram as far as the Juneteenth programs. But the Somerset County Caucus held at the gazebo. If you allow me just 1 second to read this. On June the 19th, 2021, the first time Juneteenth was a state and federal holiday, the Democrat Black Caucus hosted a Juneteenth celebration at the municipal complex in Franklin Township. The township simultaneously sponsored the COVID-19 vaccinations there. The event featured Councilman Tom Maliski, if I pronounced his name correct, and Assemblywoman Sumter, who spoke about the bill they are co-sponsoring in the Congress and in the Assembly on the Commission to Study Reparations. It also featured the Honorable Chanel Robinson, Director of Somerset County Commissioners, as well as other dignitaries, including our own mayor, Professor Bill Davis from Rutgers University also gave an informative information about Juneteenth. In addition, there were local talent who performed celebrating the richness of Black culture. The Juneteenth holiday is an annual commemoration of the end of slavery in the southern states of the United States. Although the Emancipation Proclamation freeing slaves in the Confederate States was signed January 1st, 1863, enslaved African Americans in Galveston Bay, Texas, learned of their freedom from the Union Army June 19, 1865. After the Emancipation Proclamation was announced, Juneteenth is the longest standing African American holiday observed in the United States. And that's very important because of the laws that are being passed all over the country restricting voting rights. It's very important for people to understand and voice their concern, because at the end of the day, we're the ones that are going to suffer. It matters not Republican, Democrat, Independent. And I say that because it affects everyone. It's not just African Americans. It's not just anyone. It's everyone. And Mr. Mayor, that's all I have to say.
Thank you, Councilman Wright. Councilman Chase.
Thank you, Mr. Mayor. I don't have much to report. There haven't been any committee meetings since our last meeting. The Environmental Commission is talking about starting a diet adopt a drain program, encouraging residents to agree to keep the storm drains in their neighborhoods clear of leaves and anything that might clog them, so that water in the streets will drain properly. We'll be developing a statement to send to council for endorsement. And I attended, and I suspect other members of the Environmental Commission attended, an ANJAC webinar on the plastic bag ban, which will go into effect on May 4th of next year. But we'll have to have an educational campaign from now till then to both educate everybody to get a reusable bag, get several reusable bags, and have them available whenever you go to a store, because we also have to educate the stores to not have plastic bags anymore, not even have large stores more than 2,500 square feet cannot offer paper bags. Smaller stores where people probably make smaller purchases and if necessary can take them in a smaller paper bag. Smaller stores can still have paper bags. And of course, another part of this is generally banning polystyrene food containers, although for 2 more years, the prepackaged foods, especially say meats, the meat counter in your supermarket will be allowed for another couple of years, and hopes that they will find an alternative by then. So you'll be hearing more about this as we go along toward next May. We'll also, the Environmental Commission is also going to ask the council to spend some of the Clean Communities grant to buy reusable shopping bags to be handed out at events such as the 4th of July and Franklin Day. And I would suggest also at the food bank. So these are things that will be coming up more and more. So thank you, Mr. Mayor.
Thank you, Councilman. Councilman Charles Onigiaka. Councilman, you're muted.
Hello. Okay, thank you, Mayor. Unfortunately, I could not attend the Juneteenth event that happened last week because of job-related event. But I heard that it was well attended and everything was organized properly. So I thank the organizers very, very attended. And no doubt about it. I know the Juneteenth will educate people on African culture and Black history. To me, this is there's still a work to be done, which is exactly why the importance of this holiday is established. It's established as a beautiful expression of hope and resistance and the acceptance of humanity. No doubt about that. In Franklin, Franklin is a melting point in diversity. So we don't have any problem in meeting this request. To me, I think there's an importance of this June event. Thank you, Mayor. This is what I have for the night.
Thank you, Councilman. Deputy Mayor Jim Vasanella.
Thank you, Mayor. still hear an echo. Oh, okay. Thank you, Mayor. And thank you, Councilman Wright, for giving some summary of the historical significance of this holiday, which finally is where it should be in the national spotlight and celebrated and acknowledged for the important milestone in this country's history that it is. And with that in mind, next month, another major milestone, 4th of July. Independence and freedom, really the most important quality, most important things a country could be based on. But anyway, next month, a couple of weeks, 4th of July, actually it'll be the 2nd of July, we're going to have our wonderful fireworks for the first time in 2 years. So please come out. It's going to be kind of a picnic type of environment, as much as we'll have music, but we'll not have the usual games, fanfare and vendors and games, but we will have everybody be welcome. Bring whatever food and non-alcoholic beverages you want, and we will hopefully have a wonderful weather and a wonderful fireworks show. We did not have a public safety committee meeting tonight because of the Board of Health meeting, and we will be having a public works meeting before the next council meeting, where we fortunately will be able to add a few roads to our paving program because of some money that has been left over from past paving projects that were not quite as expensive as we initially thought. So the paving program is actually going to be back close to, if not at where it's been in the past, because of the fortunate extra funds. And if there was ever a year that came in handy, it was this year. So that's it, and hope to see everybody. I hope that everybody has a wonderful 4th of July, and see everybody at the fireworks on July 2nd. Thank you, Mayor.
Thank you, Deputy Mayor. So I was able to attend both the county and the township Juneteenth events. I also, as mentioned, was there to celebrate Resta's gas station's 75th anniversary. I was honored to be allowed to select a person to receive a free car from him. The person I selected was a widowed mother of 4. And full disclosure, Pastor Soares helped me make that selection. So that was very gratifying. As part of, to continue, I'm going to ask Mr. Renone to discuss the legal obligations the town has of remote meetings versus in-person meetings. It's because it's changed, our understanding of it has changed since our last meeting.
Thank you, Mr. Mayor. As the council knows, the legislature adopted and the governor signed about 2 weeks ago, maybe 3 weeks ago now, legislation which ended, which set an end date for the public health emergency, and also ended a number of executive orders that were issued by the governor. There probably were something in the neighborhood of 100 in total, but it eliminated many of the executive orders that have controlled the manner in which both the state government and municipal governments have worked. One of the emergency rules that was adopted in September of 2020 put into effect the state law which allowed the Open Public Meetings Act, which amended the Open Public Meetings Act and allowed for municipalities to hold meetings solely on a virtual platform, such as the platform that we're on tonight. The DCA regulations went into effect. They were originally indicated to be 30 days, but they were continued by executive order. So when they passed the new legislation, we began the process, and we began talking to people at DCA and people in other towns as to how it is that those DCA regulations were going to be handled and based upon a new law. what we have determined, and you're seeing it play out in a number of municipalities, is that effective July 4th, the public health emergency has been terminated, but the state of emergency has not. The state of emergency continues in effect, and the DCA regulations are actually continuing for 90 days after the state of emergency was terminated. So effectively, you have until, I think when I did the date calculation, October 1st, you still have the ability to utilize the solely virtual platform for your meetings. In other words, not have a physical location for your meetings. So once we, got through all of the legislation, I got back to council and, I got back to the manager and then the mayor, and I believe I might have let the clerk know also that you now essentially have the freedom to not come back to in-person meetings up until essentially your second meeting in September. And I just wanted council to know, I know council was struggling with the issue of how it is you were going to conduct your meetings and whether or not there was going to be social distancing or mask mandates. And I just wanted council to know that, you can kind of take this on a meeting by meeting basis. If at any point you decide that you want to come back in person between now and that date in September when you're going to have to come back, you would simply have to pass a resolution at one meeting and have it effective for the next meeting.
Thank you. So at the last meeting, we discussed that we were going to come back to in-person meetings in July, thinking that the law basically required us to do that. Prior to that, council had set September as a time to come back. So I think we need to give some direction to primarily our clerk, who has to advertise these things, as to where we want to go. I would, usually as chair, I speak last, but on COVID issues, I've spoken first. I'll take that privilege this time as well. I think that Mr. Ranone kind of mentioned it very briefly. I think we need to do it. We should do it on a meeting to meeting basis. To me, the bottleneck is the worst, I shouldn't say the worst, the most crowded meeting we can think of, which hasn't lately been council chambers, but conceivably could be in the zoning board or the planning board. So we've decided as council that whatever we do, we're going to do as a whole. We're not going to have the ag committee do one thing, open space committee do another thing, council do another. We're going to do it all at once. And to me, what we have to decide is, when are we comfortable with people being shoulder to shoulder, all seats full in the council chambers, standing room only, for perhaps a contentious zoning board meeting or perhaps a contentious council meeting. I personally am not comfortable with that yet, even if everyone was wearing masks. So I say that we, our next meeting is July. We only have one meeting. I suggest that the entire township for the month of July not have in-person meetings, continue with remote. Anyone else wish to speak? Okay, so
Well, Mr. Mayor,
yes, Councilwoman.
yeah, I think with hearing on the news with the new Delta variant, which seems to be more stronger and more deadly than the previous COVID coronavirus, I think that's probably a smart move going forward. So I would agree with your statement.
Okay, thank you. Anyone else? Councilman Chase, you're muted.
I've been keeping track of our 7-day running average of cases in the township, and we'd gotten down to less than 1. And then over the last week, there was a little bump up again. We were getting 3 to 4 cases a day. Happily, that's gone down a bit, but tells us that it's still out there, and we probably should continue to exercise as much care as you suggest. I don't know how many people have been virtually attending zoning board meetings. I know there is a very contentious case before the zoning board, which is probably our concern for possible crowding. But I think we've just, I think they had a meeting on that last Thursday and don't have another one until September. So yeah, we should continue for another month at least and see how the situation is then. Because otherwise, our smaller committees, I think, would be happy to have meetings in person again. And for instance, on the Environmental Commission, when we met in person, we could spread out physical plans for proposed development. Trying to read them online is much more difficult, but we'll play it carefully for at least the next month.
Anyone else? So I'll make the motion, on as unaccustomed as I am to making motions as chair, that we continue with remote meetings until discussed and will be discussed again at the July meeting. Do we have a second on
A
that?
second.
Okay. Is this by acclamation or by vote? Madam Clerk, should we call a roll or?
Mr. Mayor, you don't, it's not a formal resolution, so all you're doing is expressing the sense of the council that you're not going to put a resolution on. So if you're going to continue in the remote meetings, I think you can do it by voice vote.
Okay, thank you. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. And now the meeting begins. We have no minutes to approve. Approval of the warrants in the amount of.
Mr. Mayor, I have a report,
Oh,
and I am an agenda item.
you are an agenda item. Shame on
I
me.
am. So I have actually several items to report. First, I'd like to answer Mr. Guy's questions regarding our pool and spray park, as well as our summer programs. I think I reported back in the last council meeting that the Recreation Department will in fact be sponsoring in-person summer camp. The pool is scheduled to open on June 28th, which is next week. Swim lessons as well. The pool will be open Monday through Friday from 4 to 8, Saturday noon to 8. So hopefully we'll have some warm weather to get that water warm and not be ice cold like I'm sure it is right now with the 60-degree weather out there right now. And summer camps also begin on the 28th, as do most of our summer recreation programs. So they'll be in full swing next week. Just repeating what Deputy Mayor Vassanella talked about, Independence Day fireworks are scheduled for July 2nd. Entertainment begins at 7:30 p.m. in the gazebo. Fireworks are scheduled at 9:15. So we certainly are looking forward to having everyone back in the municipal complex for fireworks. I had a text message from Councilman Wright just before I started my report, and I'm going to make an assumption that and talk about something that I think he was going to ask me a question about, and we'll see if I get it right. As many of you who drive through the town know, there are 2 railroad crossings in Franklin Township on Township roads, one on Veronica Avenue and one on Clyde Road. And they periodically fall into a state of disrepair. Conrail has been somewhat slow to repair them over time. We've had several meetings, but the Public Works Manager and the Township Engineer and I have had several virtual meetings with representatives from Conrail, and they have agreed to allow us to remove the rails on both Veronica Avenue and Clyde Road and we'll be bringing a contractor in once we remove the rails to pave over, and basically it will be no longer a railroad crossing. It will be just a regular piece of asphalt, and hopefully we can resolve this issue. They are not going to abandon the railroad tracks. They said that if in fact there is ever call for those railroad tracks to be put back into service, we would have to install now you can have a one-piece rail crossing, much like there exists on Route 27 near Churchill Avenue. So that's what we would install if ever that had to happen. I don't anticipate that ever happening, but in the event, that was the agreement. And so we are going to remove the rails and then have a contractor come in and do the paving. So it'll be included in one of our contract bids that will be going out shortly for our overlay project. And I'll take it by a nod of the head, Councilman. Did I get it right?
Pardon, I believe, if I understand you correctly, what about the rail that runs behind everyone's house? Is
Well,
that
they're not abandoned. They will not abandon the rails. That's why I said it. I asked them if they would. We went and they brought it up to the executives at Conrail, and they are not prepared to abandon the rails at this time. So they're going to continue to be railroad tracks behind people's houses where there are railroad tracks now, but the crossings will be replaced with asphalt.
That's it. Thank you, Bob.
You got it, Councilman. One other thing to report, as some of you out there may be aware, because you've already gotten them, the township is one of the pilot projects for Somerset County to roll out a new recycling program that replaces the single can which you put all of your things in with dual totes that are a little bit larger and have wheels, one tote for cardboard and paper products, and one tote for glass, plastic, and tin cans and aluminum cans. I'm going to just share the next portion of the town to roll out, and the plan is to distribute the well, let me get it up here so I can have my screen. Okay, there we go. Okay, so a flyer will be distributed to residents explaining it. That is the flyer there. It explains the dual stream program. I'm not going to leave that up here forever, but you will get it if you're getting your can, and the next ones to get it will be this section of town, which, can we all see that map?
Yep.
Okay, so it is South Middlebush Road, Jake's Lane, Canal Road, Amwell Road. So the Wildflower Ridge Development, Sunflower Development, East Millstone, those people along the roads within that zone, on July 1st will receive their new totes. And if you wish to keep your old tote for whatever purpose, either overflow or you want to use it for another purpose, you certainly can do that. If you do not want it, in the instructions, you will find that if you notify the county, they will pick up your old tote when they pick up recycling, and you'll have the two new ones in its place. And the plan for that program, and I've discussed this before every time a new part of the town is rolled out, is that ultimately all of the town will receive the dual tote, except for the cluster residences, townhouses, and condos that have a limited space, and they will continue to either use dumpsters supplied by the county for their recycling or use the smaller totes. So, and that's my report, Mr. Mayor.
Thank you. So we were up to warrants. Warrants in the amount of $2,537,978.75 on June 22nd, 2021 are presented to the Township Council for payment. Do I have a motion on the warrants?
I move that the warrants as read be paid.
So we'll take Dr. Chase and Francois, the mover and seconders. Any discussion? Anyone want to pull an item or question an item? Madam Clerk?
Councilman Embarrasson?
Yes.
Councilman Chase?
Yes.
Councilwoman Francois?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Jaka?
Yes.
Councilwoman Pruitt?
Yes.
Councilwoman Udine?
Yes.
Deputy Mayor Vasanella? Councilman Wright?
Yes.
We're on to the 2021 Community Development Block Grant Action Plan. So we've been going over these in the past recently, and those were for prior years. This is for this year. A public hearing is appropriate. Do we have a motion to open to the public?
So moved.
Second.
Moved and seconded. All in favor, say aye.
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 Opposed, say nay. Motion is carried. We are open to the public. Mr. McQueen, I do not, for some reason, I can't bring up the attendee list. Oh, wait, there it is. And I only see people, I guess, who want to speak now. So you're on your own and monitoring that. Anyone wishing to speak will have 3 minutes to speak. Same
Yes.
rules as before.
Yes, Mr. Mayor. Anybody from the public wishing to speak, use the chat function, raise hand feature, or *3 from your telephone. Leah is unmuted. Leah Convery.
Hi, this is Leah Convery, 43 Townsend Court, Franklin Park. I wanted to talk about South Middlebush Road, those two projects, and are we going to get
Excuse me, this public portion is only for community development block grants. The general public portion has already been passed. So unfortunately, there's no further opportunity in this meeting to discuss that subject.
Fine. Okay.
Sorry. I wish you were otherwise.
Okay, anybody else from the public wishing to speak specifically on this community development block grant application, please raise your hand or use *3. Mr. Mayor, I do not see anybody else indicating they would like to speak.
Okay, so my panel indicates there are 12 attendees, but I only see people wishing to speak. Are you able to see the whole list?
Yes, I can.
Okay, so you're confident. So there's no one else wishing to speak. Do I have a motion to close the public hearing?
So moved.
Second.
Moved and seconded. I'm sorry, all in favor of closing public portion, say aye.
Aye.
Opposed, say nay. Motion is carried. We are now on to resolution 21-195, approving the filing of the fiscal year 2021 Community Development Block Grant Action Plan. Do we have a motion on the item?
So moved.
Second.
Moved and seconded. Any discussion? Madam Clerk?
Councilman Embarrasson?
Yes.
Councilman Chase?
Yes.
Councilwoman Francois?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Jaka?
Yes.
Councilwoman Pruitt?
Yes.
Councilwoman Udine?
Yes.
Deputy Mayor Vasanella?
Yes, for any portion that doesn't have to do with Central Jersey Housing Resource Center. I would abstain for any portion that has to do with that.
Councilman Wright?
Yes.
And it passes. We are now on to public hearing and adoption of ordinances on second reading. First reading is to introduce it to the public to let them know that we will be voting on it. This is an ordinance 4340-21, an ordinance by Franklin Township in Somerset County, New Jersey, permitting the operation of any class of cannabis business within its geographic boundaries and amending Chapter 112 of the Franklin Township Land Development Regulations by creating new chapter 346 entitled Establishment of Cannabis. So if everyone could mute, please. Okay. Establishment of cannabis transfer tax and user tax in Franklin Township is presented to the public for public hearing and final adoption. The public hearing has been noticed as required. So I have a motion to open to the public.
So moved.
Second.
Second.
And I apologize, that was my phone making the noise. Moved and seconded. Moved and seconded. All in favor of opening to the public, say aye.
Aye.
Opposed, say nay. Motion is carried. So we are open to the public on the item of cannabis in town only. Again, 3 minutes to speak. No yielding of time. State your name and address. Mr. McQueen.
Yes, anybody from the public wishing to speak, we ask to use the chat function, raise hand feature, or *3 from your telephone. Again, if you would like to speak, use the chat function, raise hand feature, or *3 from your telephone. Jason, you are unmuted.
Yes, thank you. This is Jason Tabachnik with Tabachnik Fine Foods. We're over at 1230 Hamilton Street. I attended the last town meeting regarding this subject that touched upon it lightly. I just want to say that Tabachnik Fine Foods is pro-cannabis in Franklin Township. Should the township revisit the ordinance and question as to whether or not to allow storefronts to sell the product, that's on you. I'm supportive of that, but if not, I would ask that you still hopefully make an amendment that would allow companies to still manufacture or grow cannabis products within the township to ship throughout the state to other outlets as needed. We see this as a great opportunity that would create jobs and benefit the township on a tax basis. And that's it.
Thank you.
Thank you. If you could lower your hand, please, that would be helpful. Anybody else from the public wishing to speak on this topic, use the chat function, raise hand feature, or *3 from your telephone. Mr. Mayor, I do not see anybody else indicating they would like to speak.
Okay. Do we have a motion to close to the public?
Motion to close to the public.
Second.
Moved in seconded. All in favor of closing to the public, say aye.
Aye.
Opposed, say nay. Motion is carried. Mr. Dominic, you've been here patiently. Did you have something you wanted to offer?
Mr. Mayor, I don't think so at this time, except for Mr. Tabachnik. The ordinance does permit everything that you spoke about. It permits all 6 licenses and it permits the retail sale in all our retail zones. That's it, Mr. Mayor.
Thank you, Mr. Dominic. Does any council member have anything to say on this item? Going once, going twice. Okay, I'm sorry, I've never asked for a motion on the item. We have a motion. Do we have a second?
Second.
Moved and seconded. I'll ask one last time. Anyone have anything to offer on this? Hearing none. Madam Clerk.
Councilman Embarrasson?
Yes.
Councilman Chase?
Yes.
Councilwoman Francois?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Jaka?
Yes.
Councilwoman Pruitt?
Yes.
Councilwoman Udine?
Yes.
Deputy Mayor Vasanella?
Yes.
Councilman Wright?
Yes.
And it clearly passes. Thank you for your time, Mr. Dominic. Let me make sure I'm in the right place. Ordinance 4344-21, amending the Chapter 50 Police Department of the Code, Police Department of the Code of the Township of Franklin, Somerset County, New Jersey, more particularly Section 50-10, eligibility for promotion, and Section 50-11, promotion to sergeant and lieutenant, is presented for the public hearing and final adoption. The public hearing has been noticed as required. Do you have a motion to open to the public?
So moved.
Second.
Moved and seconded. All in favor of opening to the public, say aye.
Aye.
Opposed, say nay. Motion is carried. We're open to the public, 3 minutes each, same rules as before.
Anybody from the public wishing to speak on this, please use the chat function, raise hand feature, or *3 from your telephone. Mr. Mayor, I do not see anybody indicating they would like to speak.
No one come forward. I motion to close the public portion hearing.
Second.
Moved and seconded. All in favor of closing public portion, say aye.
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 Opposed, say nay. Public portion is closed. Do you have a motion on the item?
So moved.
Second.
Moved and seconded. It's pretty much as the title says. We're changing the rules for promotion, decreasing the time in grade from of sergeant to go to lieutenant, and but still keeping a long time that they have to be on the force. This has been vetted by the Public Safety Committee and is approved by the Public Safety Officer. Do we have any discussion items? I mean, anyone else wish to discuss it? Hearing none, Madam Clerk.
Councilman Embarson,
Yes.
Councilman Chase,
Yes.
Councilwoman Francois,
Yes.
Mayor Kramer,
Yes.
Councilman Oni Jaka,
Yes.
Councilwoman Pruitt,
Yes.
Councilwoman Udine,
Yes.
Deputy Mayor Vasanella,
Yes.
Councilman Wright.
Yes.
And it passes. Ordinance 4348-21, an ordinance of the Township of Franklin County, Somerset State of New Jersey, authorizing the acceptance of a conservation easement from Dominic DeSantis to the Township of Franklin for premises known as Block 514, Lot 15, 16 Heller Park Lane, is presented for public hearing and final adoption. The public hearing has been noticed as required. To have a motion to open to the public.
So moved.
Second.
Moved and seconded. All in favor of opening to the public, say aye.
Aye.
Opposed, say nay. We are open to the public. Same rules. Mr. McQueen.
Anybody from the public wishing to speak on this matter, please use chat function, raise hand feature, or *3 from your telephone. Mr. Mayor, I do not see anybody indicating they would like to speak.
No one come forward. I motion to close the public portion hearing.
Seconded.
Moved and seconded. All in favor of closing public portion, say aye.
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 Opposed, say nay. Motion is carried. Public portion is closed. Do I have a motion on the item?
So moved.
Second.
Moved and seconded. Any discussion?
Always good to get another conservation easement.
Madam, yes, I do live for them. Madam Clerk.
Councilman Embarson,
Yes.
Councilman Chase,
Yes.
Councilwoman Francois,
Yes.
Mayor Kramer,
Uh-huh.
Councilman Oni Jaka,
Yes.
Councilwoman Pruitt,
Yes.
Councilwoman Udine,
Yes.
Deputy Mayor Vasanella,
Yes.
Councilman Wright.
Yes.
Boy, does this council know how to have a good time. Ordinances on introduction and first reading, there are none. We are on to the consent agenda, items A through AI. Now, there's a healthy consent agenda, finally. As listed on the consent agenda portion of this meeting, are presented to the Township Council for adoption. To have a motion on the consent agenda.
So moved.
Second.
Moved in second. Anyone want to discuss an item, pull an item, question an item? Hearing none, Madam Clerk.
Councilman Embarrasson?
Yes.
Councilman Chase?
Yes.
Councilwoman Francois?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Jaka?
Yes.
Councilwoman Fruit?
Yes.
Councilwoman Udine?
Yes.
Deputy Mayor Vasanella?
Yes.
Councilman Wright?
Yes.
Very good. I will point out that AI was appointing a sustainability consultant to the Environmental Commission. We have no resolutions to be voted on separately. Old business, boards, committees, commissions. Do we have anyone we wish to appoint to a board, committee, commission? Hearing none. There is no executive session. Do we have a motion to adjourn?
Motion.
Second.
Seconded.
Moved and seconded. All in favor of adjourning, say aye.